Hello everyone. Today I'm going to be talking about a policy that is preventing school violence through optimized mental health screenings. I am presenting a federal policy proposal designed to build a sustainable, preventative mental health infrastructure in schools. This proposal focuses on annual mental health screenings supported by a federal incentive program with a pilot launch in Michigan. The goal is simple: to reach students before a crisis occurs. According to the K-12 shooting database, the most comprehensive count of gun-related incidents on school campuses, there have been 209 shootings so far in 2025. This number reflects more than isolated acts of violence. It points to deeper systemic issues, including unmet mental health needs and the absence of early intervention systems that could identify distress before it escalates. These patterns highlight the urgent need for stronger support structures for students who may be struggling. COVID-19 further intensified these challenges. The pandemic disrupted daily life, created prolonged isolation, and limited young people's ability to cope with mental health stressors. According to the CDC Adolescent Behaviors and Experiences Survey, 44% felt persistently sad or hopeless during the pandemic. That percentage did not simply disappear post-pandemic. While conversations about youth mental health have increased, the CDC Youth Risk Behavior Survey found that 20% of adolescents ages 12 to 17 reported having unmet mental health care needs. This statistic underscores a pressing reality. When mental health needs go unaddressed, distress can manifest in harmful ways. Mental health is directly related to the broader context in which school shootings occur, making this a national level issue. Rates of anxiety disorders and depression among youth continue to rise. While mental health challenges do not inherently lead to mass violence, patterns of distress, unmet needs, and breakdowns in support systems often appear in the background of these tragedies. Early intervention is essential. Although some policies exist, they are inconsistent across states and often lack the funding and infrastructure needed for meaningful impact. As a leading nonprofit, I believe policy change is the most effective path toward addressing this issue. What is needed is a comprehensive system that reaches students before a crisis occurs and helps prevent tragedy in multiple ways. While there are many reforms necessary, the first step is to have better data. Although extensive information is collected after school shootings or other tragic events, far less is known about the warning signs and unmet needs that precede them. Understanding these gaps is critical to building effective preventative strategies. Looking at local, state, and federal policies surrounding this topic, there is a lot of data focused on school wellness, especially post-COVID. And let's take a look. According to JAMA Network Open, in a study from 1,100 principals, about 1/3 of U.S. public schools conduct mental health screenings. Most of these decisions are made at the district level, and they are not mandated by states. However, JAMA Network also discusses that policies that promote federal and state funding for school mental health services, reimbursement for school-based mental health screenings, and adequate school mental health staffing ratios may increase screening rates and successful connection to care. This leads to the statistic where 56% of public schools cited inadequate funding as a factor limiting their ability to strongly agree that they were able to effectively provide mental health services, which was taken from the National Center of Education Statistics. So while there are local, district-based changes being made, and it is known that local policy brings much more substantial change, there are a few examples of mental health screenings as a state policy, such as Illinois. They have a universal mental health screening, the Public Act 104-0032, saying schools must offer mental health screenings beginning in the 2027 to 2028 school year, but only if the state procures a free self-report screening tool. This is a state incentive policy. If the state provides the tool, districts must implement. If they do not, there is no mandate. There are also examples of state implementation of mental health-focused policy, such as North Carolina's SB 105, or SL 2021-180, allocated funding from the American Rescue Plan Act to establish a grant program for schools to hire psychologists in response to COVID-19. So there is a foundation of state policies. However, they vary on state funding, focus, and other factors. There's a disparaging difference between different state plans and support systems. According to Effective School Solutions, mental health funding by state are reliant on federal funding. And this federal funding involves ESSER, COVID relief, where $122.8 billion nationally were given supporting school mental health services. Bipartisan Safer Communities Act, BSEA, over $280 million for school mental health programs distributed throughout the states, and then Medicaid and CHIP, the largest funder of children's mental health services, covering 50 to 70% of state expenses. So there is a lot to do with the funding of local and state policies. So what is the problem? So taking a look at the landscape of state, local, and federal policy, where does that take us now? Despite growing awareness, the U.S. lacks a coordinated, sustainable, and preventative mental health infrastructure for schools. Even today, I did not experience any mental health help throughout my schooling, and only just now through my college have I been provided tools to learn and to have more support systems. And while there are developing policies in place, the United States still face three major systemic failures that will limit equitable access to school-based mental health support. Failure number one is there is no national standard. Because policies vary widely by state, there is no stabilized nationwide framework ensuring consistent access to mental health resources. This creates significant inequities, with some states offering robust services and others offering none. Failure 2. Funding instability. Local implementation depends heavily on federal funding, yet major programs like ESSER are temporary, and philanthropic grants are inconsistent. Without a dedicated long-term federal funding stream, critical components of mental health infrastructure remain fragmented or missing entirely. And failure 3. Lack of early intervention infrastructure. Many states have no preventative programs in high schools, colleges, or general education settings. Most policies respond only after a crisis, rather than investing in early intervention systems that could reduce harm before it occurs. These failures are further shaped by state-level differences in gun laws and safety priorities, which influence how urgent mental health prevention is treated. Together, these problems reveal a system where access to support depends more on geography and temporary funding than on a consistent national commitment. Looking at my proposed solution, I believe a federal policy is necessary because it ensures that all states, regardless of funding priorities, have access to consistent, sustainable mental health support for students. A national approach also reduces inequities created by state variation. So my proposal is a federal incentive program that is opt-in, like the Illinois opt-in policy. States that implement annual mental health screenings will receive additional Title I funds, school-based mental health grants, and priority access to federal school safety. This encourages widespread adoption without imposing a mandate. However, understandably so, there would be implementation challenges that would vary across state, especially depending on legislation issues and the rate at which things are passed. Because of the scale of this policy, I propose launching a pilot program in Michigan. Michigan is well positioned due to its data-driven education system. There's diverse school environments, there's urban, suburban, rural, charter, public, and private, and its recent experiences with the Oxford school shooting. So how would the screening program work? Well, there would be the screening process first, functioning similarly to an annual sports physical required by most schools to do athletics. It would be a standardized mental health check-in administered by a licensed clinician, school psychologist, or a contracted provider, and costs would be covered through the federal incentive program. This also would be a validated questionnaire, meaning everything is standardized, so data collection can be based on de-identified data with no personal markers, explaining participation rates, and explaining concerning areas such as well-being, where individual results would only be shared with parents or guardians and appropriate school mental health support staff. Privacy protection. All of the data is reporting to the state and federal level would be de-identified. There would be no personal markers, and individual student information would remain confidential and handled in accordance with FERPA and state privacy laws. And this whole program would be evaluated after a run of 2 years, where screenings conducted twice per year. Evaluation metrics would include participation rates, referral outcomes, changes in reported mental health indicators, and feedback from students, families, and school staff. Annual screenings are a foundational step toward building a preventative mental health infrastructure. They provide students, families, and schools with early insight into emerging needs and create the data necessary to design effective long-term solutions. Transitioning to our stakeholders, there are a lot of key figure holders that are involved with promoting, lobbying, and implementing this pilot program. Building strong relationships across education, government, and advocacy sectors is essential for success. First, starting with the Michigan Education Association, or MEA. It's the largest union representing Michigan teachers and school staff, highly influential in shaping school-based policy. They can advocate for mental health resources and support implementation. Additionally, there's the Michigan Elementary and Middle School Principals Association, where principals are operational leaders who would implement screenings, provide insight on feasibility, staffing, and logistics, as well as the Michigan PTA. This represents parents' voices statewide, school board decisions, and community, and can build parent support and reduce stigma. Next is the Michigan Department of Education. They oversee statewide education policy, funding, distribution, and compliance. They would manage the pilot program and coordinate with districts. And last but not least, there's Governor Gretchen Whitmer. She holds executive authority to champion statewide initiatives and secure funding. She can support pilot programs and elevate public messaging. Thinking of public messaging, we also want to think of advocacy and youth voice. There is NAMI, the National Alliance on Mental Illness, a leading national mental health organization with policy influence and public trust. They can provide expertise on screening tools, training, and stigma reduction. They collaborate on practices and public advocacy, as well as they have their own established club at Rochester Christian University already. Then there is the Maternal Mental Health Alliance. They have a strong advocacy network focused on family, mental health, and early intervention. They support messaging around prevention and family-centered care. There's the Michigan Youth Advisory Councils. Youth are directly impacted and bring lived experience. Their involvement strengthens legitimacy and equity, and they could provide feedback on screening tools and student needs. There's also the Little Lobbyists. They advocate for children's health and disability rights with strong equity lens. They amplify youth-centered messaging and highlight disparities in access to care. They engage to support equitable implementation and inclusive communication, as well as the Michigan School Safety Commission. They oversee statewide school safety strategies and crisis prevention planning. They can integrate mental health screenings into broader safety frameworks and position screenings as proactive safety measures that reduce crisis-level incidents. In conclusion, this is a commitment to prevention. This proposal addresses the 3 critical system failures identified. It establishes a pathway towards national standards through federal incentives. It creates sustainable funding, and it builds early intervention infrastructure. By starting with a well-designed pilot in Michigan, we can gather the evidence needed to approach this nationwide. And the time for this action is now. Remember, there was 209 school shootings already in 2025. 20% of adolescents report unmet mental health needs. We cannot afford to wait. I have personally had fear of going to my university purely because I know that it could happen. This federal incentive program offers a practical, evidence-based path that respects state autonomy while ensuring no student is left behind. Michigan can be the proving ground for a national movement towards prevention, early intervention, and genuine support for student mental health. Mental health conversations are just the beginning. A federal incentive program is not just a policy. It's a commitment to the future generations. Merry Christmas, and thanks for listening. Included here are the reference I used, separated by stakeholders, policy, websites, and other information.